Today topic is patient medication history review. In this patient medication history interview, a medication history is a detailed and accurate complete account of the all prescribed and non-prescribed medications that a patient had taken or currently by taking prior to a newly initiated ambulatory care. It provides valuable insights into the patient's which allergic tendencies, adherence to pharmacological and non-pharmacological treatments, the use of self-medication with the complementary medicines. By interviewing a patient in collecting the data medical history, it is called as medication history interview. The definition of the patient medication history interview is, it is defined as a complete account of all prescribed and non-prescribed medications that a patient had taken, newly initiated or ambulatory care. The interviewing a patient in collecting the data medical history is called as medication history interview. The main goal of this medication history interview is to obtain the information on the aspect of the drug by the use of all care of the patient. In that information, the information which gathered can be utilized to compare the medication profiles with the administration record and investigatable dispenses. And it is used to verify the medication history which is taken by the staff and which provide by the information where appropriate. The document allergies and adverse reactions, drug interactions, medication complaints and evidence of the drugs. These all are main goal of the medicational history interview. And why this need to the patient by getting the patient medication history interview? What is the use of this patient medication history interview? Because it is need for the patient to prevent the prescription errors, and apart from that preventing prescription errors, accurate medication histories are also useful in the detecting drug related pathology which change the clinical signs by the resulting drug therapy. A good medication history should encompass all currently and recently prescribed drugs, that previously adverse drug reactions, which includes the hypersensitivity reactions. A full medication history contains identifies of the patient needs and exploring the patient perspective and illness, the patient medication history interview, why it should to be documented means, here we have to review the current medical treatment and identify suitable additional treatments. So that's why these all medication history will be documented. And research has established that in routine practice, pharmacists should provide the most accurate history when compared to the health professionals. So that's why it is important role for the pharmacist to fulfill the well prepared, structured, complete information to the patient. Some of the following information which is commonly recorded, that is prescribed medicines, over-the-counter medications, vaccinations, alternative medicines or remedies, and which medicines that is found to be ineffective, and interviewing process. In this patient medication history interview, we should have to interview the patient according to his time. In this interviewing process, there are 8 types of questions are there. They are information source, questions to ask, medication history, and other questions like about the medication, and additional questions to explore the complaints of the drugs, and client education, and cards which is given by the doctors, that is nothing but medication history scripts, and reconciliation and documentation of the patient. These are the some steps which is involved in the interviewing process. First we have to inform the source, means here we have to know about the patient, family, and their medication list, community pharmacy, and which drugstore he is purchasing the drugs, and which doctor he is consulting. This is most important one. And second step is questioning to the patient. In these questions, we have to ask him or her some basic questions like which community pharmacy do you use, and which medications are you currently taking, is there any allergies to medications, and what was the reaction about that medication, can you tell the name of the medication. And these are the some type of questions, and I'll study that questions, I'll repeat that questions. Okay, you have to listen. What is the dosage form, how much amount of how much dose you are taking daily in your daily routine, and how are the taking, by which route you are taking the drugs, and how many times a day, and what are the prescription medications are you taking on the regular basis. These are the some types of questions. And after the asking questions, we have to give some tips. We have to need to give the tips to the patient. That is, by asking the non-biased questions and avoiding the leading questions, and we have to avoid the medical jargon, keep it simple, and to avoid the judgmental comments, and review of the system will be like smooth, and then pain medications, stomach medications, which about these types of tips we have to give to the patient. And some other questions are there to ask the patient after the giving tips. They are, do you change the dose after using these medications? Do you sometimes stop the taking your medications when you feel better? Or do you stop taking your medication if it takes you feel worse? Have you recently started any new medication? And did your doctor change the dose of your medication recently? Did you change the dose of your medications which is having some side effects about any reasons? And these type of questions you have to ask the patient. And after these steps, sixth step, that is client education. We have to educate that patient, like we have to encourage them, and by giving support and by advising them as their life medications, like lifestyles, changing lifestyles, healthy lifestyle, and daily routine, changing the daily routines likewise. And after that, cards of medication history script. Could be like this. Okay, here I am giving this video. That is, any allergies, do you have any eye allergy, like what, These are the some questions. After that, documentation. Finally, we have to document the patient complaints in a record, that is which is containing a list. We have to need some OTC drugs also, and which include the medication prescribed by the other physicians also, and inform the physician if client is not taking as prescribed. The documents in the client chart will be date made recompleted. Any patient information in the progress note should be given.